Welcome to Neuro Stories, the podcast that highlights the people behind neuroscience at the Walton Centre. Together, we'll lift the lid on the complex worlds of neurology, neurosurgery, and everything in between, hearing fascinating tales of the incredible staff and services carried out in the hospital every day. In this episode, we're speaking to two ward managers, looking at the similarities and differences of two wards here at the Walton Centre. Hello, you alright?
I am Abbie Ward Manager on Cairns Ward in the Walton Centre.
So, Abbie, why nursing for you?
I suppose there was a couple of influencing people and factors. I was in and out of hospital as a child, nothing serious, just kind of short hospital stays. And I suppose the people that cared for me during my hospital stays sort of prompted that curiosity about what a nurse is and what they do and how they care for people. So I think it come from probably early years at that point, and then a little bit later in life, I had a really close family member who had a brain tumour, and she was cared for at home by an absolutely fabulous team of community nurses. And I suppose, again, it's just that impact that they make and how positive that was.
Is it something that you thought, oh, well, I'll keep that in mind when I'm like going to school and I'm going to college and stuff?
No, it was a definite. I think I'd said it all. And it's sort of that cliche, isn't it? I've always wanted to be a nurse. But I think from that really quite young age, I think I was only in like year 1 or year 2 of school when I had that hospital admission. So it was kind of like from a real young age that was sort of set, and you've got the things at home from when you were a little one where it's like, when I grow up I want to be, and they're all still there as like a reference of...
And it was always nurse?
Yeah, it was always the same. I think I went through a little spell where I said I wanted to be a social worker, and my mum was like, I don't think you do. I think the pathway that you're going on suits you a little bit better. It suits your nature, it suits your personality, and it can sort of envision you doing what you've always wanted to. Did
you have those moments, I guess, when you were educating that you thought it's reassuring and it's reinforcing that early decision that you made? Yeah,
definitely. I think through college I had some very supportive tutors, but I do remember a conversation where it was a little bit like, you're not doing sort of those specific science subjects, so I don't know why you're applying because you'll never get in.
Gosh.
And I remember that, like, wow, that was like a real smack in the face, and like it really took me back, but it didn't deter me because I suppose at that point the passion was already there and was already progressing through like uni applications and interviews and whatnot, and if
you were going to be a nurse, whatever you wanted.
Yeah, just drives you more, doesn't it, when there's a little bit of doubt there sometimes.
That's more of a comment on your character as well, because a lot of people would get that feedback and go, oh God, maybe this isn't right, and I'll try and do something maybe easier or different and try something else. But you went, no, right, wake up call. I'm going to make sure that I do what I need to do and get through it.
Yeah, definitely. And I always knew, well, I always had it destined to go through the university that I went through, and that was the one I had my heart set on. And so
Where
everything
did you study?
kind of University of Liverpool. Would recommend it to anybody. But I think, then you go into such a really welcoming environment, which was really small cohorts. We were really well looked after. We had so much support. So there's a high dropout rate in nursing, and that's like nationally recognised because of the complexities of the course and how difficult that can be, and the demands of theory and placement and whatever else. But when you've got that network from such a really supportive institution, it's really helpful.
Tell me how you then did that and then came to the Walton Centre.
All a little bit by accident. So I had a placement on intensive care at the Walton Centre, which I absolutely loved and completely changed my thought process on where I wanted my career to go. I was at that point adamant, I want to be an ITU nurse. The care and dedication you can give to that single patient and their families just second to none, and really, really love the environment in itself and the team and everything else. And then COVID hit us. That was ITU then kind of was a little bit more of a risky environment, so kind of closed to the student cohort that were currently there, and we were sort of reallocated to other departments in the trusts we were in, and that led me up to Cairns Ward. So I walked in the midst of an outbreak in one of the bays because it was rife at the time, and it was all very scary, and I was quite happy where I was, and I thought, I don't want to be a bedside nurse, and really just leave me where I was. I was really quite happy. But then that opened all the doors that it did, and I absolutely fell in love with the team, fell in love with the group of patients that we care for, and their families and everything beyond that. And the Walton Centre I knew I already loved as an organisation from obviously ITU's experience, and a couple of the student nurses who were students with me at the time were starting their preceptorship because they already had jobs lined up at the Walton Centre, and I was a bit like, why do they get to do that and I don't? So anyway, I reached out through training and development and whatnot and said, could this be beneficial to me as well, even though I've not necessarily got a job lined up here? Is this something like I can still attend and take a bit away from? And there was plenty of space because we weren't doing much face-to-face stuff.
Yeah.
And so I got onto the preceptorship, and with that it was like, if you're kind of on the preceptorship, you should really be thinking if there's opportunities and you want to work here, then putting your application in, and I was successful, and there we are. So it was all a lucky accident.
2026, you're a ward manager. Tell me about that.
So we started obviously as a band 5 on Cairnswood, newly qualified nurse, and again, just when you're surrounded by people with the same shared goals, I suppose, and the same outlook and the same aspirations to just do well and do very good in your job and give your absolute best to your patients. We're all very like-minded, and the team then to now remains very much the same in values and everything else that comes with it. So I think it was about 18 months in, there was an opportunity for a fixed term position on Cairns Ward, which was in a practice educator role, so more focused on the training and development of the staff, but also overlapping with some of those band 6 duties, coordinating your shifts, taking charge, etc. I absolutely loved that post, and I've definitely still got a passion for sort of that training and development side of things and just helping people achieve whatever their aspirations are. That was that. And then that became permanent at a point, again with just staff moving on to ventures new, and just as opportunities come up, and it just seemed to be an opportunity that came up, and it was a permanent position, and I really enjoyed what I was doing so far, so took that position. And then about another year after that maybe, there was need for redeployment within the organisation, so my current ward manager at the time, Liz, sidestepped to support another area, and that created an opportunity then for an acting ward manager on Cairns Ward, so I did that for a period of time, and then again opportunities come up for other individuals, and that meant that there was a permanent position available, which I was interviewed for and successful. So what's meant to be doesn't pass you by, and it's all sort of led us to where we are now.
Tell me about Cairns Ward then.
Yeah, so Cairns Ward cares for patients who have a brain tumour, so oncology patients and also patients with hydrocephalus and such related conditions. We are a 26-bedded unit, mixed male and female, and just do our very best as a ward to try and support not only our patients but so much wider than that, their families, their loved ones, their friends, because often the diagnosis that most of our patients get can be life-changing. Whether it's life-limiting or not is entirely irrelevant, but it's definitely life-changing regardless of what the diagnosis is. So we just like to be that smiley face, that support network to keep our patients and the relatives strong and going.
What does a day-to-day look like on the ward?
As nurse, I'm always trying to stay away from being sort of task-orientated, but if you were to talk through like time stamps of your day, it's kind of like your huddle of a morning, which is where all the staff get together, and if there's any key learning we need to be aware of, if there's been any incidents overnight, any slips, trips, falls, and all the key stuff that we need to know to make sure that we're all on the same page for the day moving forward, which then splits off into sort of your individual bedside handovers. So that'll be your nurse and your healthcare assistant in their clinical area will get handover for specific patients to understand in depth what they need from us in that day and what our goals are and what we're working towards. And then following on from that, it's sort of like your clinical duties, and for the nurse and staff, sort of your medication rounds, clinical observations, CT scans, that sort of thing, your bloods, blood sampling in the morning, and then we work alongside our HCAs, so all work together as one big well-oiled machine in terms of sort of your washing and dressing and that sort of thing. And then we slip into the same kind of routine again at lunchtime in terms of clinical checks and medications, and again later on in the evening sort of tea time. So the routine day to day is never the same, but in theory sounds like it should be.
So tell me about you. How do you relax after such a busy day on the ward?
It definitely helps, Sam, that we've got such a well-oiled machine, as I just referred to our team as, that, you know, you have that confidence in all of us as a team and our colleagues and our abilities and our clinical decision making, and the wider MDT, that we've got people we can escalate things to, and there's always someone on hand for support and advice, and there's always professional curiosity about how things are when you're not there. But it's personal boundaries, isn't it? We're always going to be curious about what's going on when you're not there. But we've got a really, really strong team award system sisters on Kittens Ward who are fabulous communicators as well as fabulous nurses. I've got 2 beautiful nieces who I love spending time with, so they always put a smile on your face, don't they? And I've got a gorgeous little dog, Penny, who is the apple of my eye, so anything to do with her. I mean, family, being at home, it's your safe place, isn't it? So you walk through that door and your shoulders drop a little bit, don't they? And you're just naturally in your tranquil space. But yeah, being around family, I've got a really lovely group of friends. So yeah, just making sure that you kind of put one part of your life to the side and then pick up and stay really social with the other elements as well.
Going back to nursing generally, a lot has changed, hasn't it? Where is nursing headed in your eyes?
I think there's a lot of technical advancements happening all over. There's AI everywhere. There's advances in that way, and I think the advances that are coming about are never going to be able to take away what impact a nurse can have, that physical person who is there for all the right reasons, that we can never take that away, and we'll never be, as a profession, we'll never ever be removed from the bedside, regardless of what setting that is, wards, ITU, theatres, we will always be present. But I think the advancements I'm hoping I can envision in the future, if you had all your wishes come true, will just give us back to the patients a little bit more. So hopefully there'll be advancements that make things that aren't bedside nursing a bit slicker, a bit more concise, just to release that time back, I think, which is my opinion. But if you speak to the nursing population, they'll all wish they could give more to their patients, and that is them. That is them as a cohort of people, that's them. It's their nature. But I think to be released back to your patients, to just give them all that you can, is all that we would hope for. So hopefully the advancements will enable us to do that.
Why is that important?
You need that time with your patients as a nurse, and what I would never wish for any of us, and there's definitely been shifts where we've all left thinking we could have done that little bit more, or there's been a distraction. I just think if we make our systems and our processes as slick as we can with how technology is advancing, then that daunting feeling of I could have but I didn't quite get there will be eliminated, and then the job satisfaction, which we have day to day, we're always satisfied in our jobs, but I just think it will be boosted, and then with that it boosts morale, it boosts your staff retention, it boosts your patient experience. My goal now is to just be the absolute best I can be in this role, and actually my focus at the minute is kind of how can I develop my staff and the staff who work with us. I mean, I've had all these opportunities and I am where I am, and I'm extremely grateful for all of that, but I think there's people I can see have got a real passion in certain things, or have got real potential in that field, and I think my focus now is trying to encourage them to follow whatever their dreams are. Not everybody can see their own potential, and not everybody has that level of self-belief where from the outside looking in, almost in this role I work very close with the team, but I am an outsider looking in and observing what's going on sort of outside the door or from afar. I get stuck in as much as I can, but I think you see things in people they can't see in themselves.
Right, so we're just going to leave Cairns Ward that Abbie Birch is looking after, and we're just going to walk down the corridor to Lipton Ward that is managed by Jade Gerrard. Hello.
I'm Jade Gerrard, Lipton Ward Manager.
So tell me a little bit about you.
Well, originally I did want to do cabin crew when I was a lot younger.
Oh, really?
So at the time it looked good if you'd done like voluntary work and stuff for a CV. So I was doing voluntary work in a nursing home, and I just loved it that much that I applied to be a care assistant, and then that's how I got into nursing.
And fell in love with caring?
Yeah, so I worked in a nursing home for about 7 years and then decided to go in for my nursing.
And what was that like? What was it like working in a nursing home?
I mean, it was lovely. Love going in and caring for the patients, mixing with the families. You get a general gist of what that person was like before they had the injury or the illness.
Yeah.
And yeah, it was just lovely caring for them.
So that went then into you studying to become a nurse?
Yeah, I stayed working at the care home while I went to college and done an access course, and then I went to university, but I still worked at the nursing home while I was at university. So It was quite tough at the time because I was in university full time and then working a part-time job.
That is quite intense, but did your experience at the care home help while you were learning at uni?
Yeah, because I had the basic knowledge of nursing for people. You know, you need that basic knowledge and understanding of like pressure relief and how to wash somebody and mouth care. It's the basics what you need to become a nurse.
And is it something like that where the more you do it, the better you get at it, the easier you get?
Yeah, well, it just becomes second nature to you then. It's every day you get yourself into this little routine. You think, you know, I need to wash them, I'm going to brush the teeth, I want to make sure the hair looks nice. I used to like picking clothes out for them. Like you'd discuss it with the resident, but you'd say like, oh, do you want to wear this pink skirt today and pink top? It just become everyday sort of routine.
That feels like that extra interaction with somebody and that thoughtful process that obviously you bring to nursing.
You know, you've got to have dignity as well. You've got to think, what would this person want? Because you wouldn't want to be treated, or you wouldn't want to be dressed in something, say that what you wouldn't usually be dressed in.
Yeah.
So you've just got to maintain that dignity, and you've got to think, if like that was your mum or your dad, how would you want them to be treated? Think if that was you there, you'd want the best care possible.
And how did you go from becoming a nurse there to coming to the Walton Centre?
I started on Cairns Ward because I was successful following an interview when I just qualified. Cairns Ward then used to be a rehabilitation ward.
Yes.
So it was half rehabilitation and half surgical, and it was really busy at the time. That's where, you know, I got all my core nursing skills then. We were working with a lot of patients with tracheostomies, and then in the midst of trying to care for patients with tracheostomies that were full care, you was also running like surgical bays as well.
Was it a good place to sort of like cut your teeth?
Yeah, you sort of got through in at the deep end, so you had to get on with it. But it was really busy, and it was nice to see as well, because you'd get patients in that were quite poorly, and then you'd mend them back to health, and then you'd see them on the road to recovery.
And I really see that in Lipton, because you get some really, really ill patients here, don't you? Tell me a little bit about Lipton and what it's about.
So Lipton Ward is basically a hyperacute assessment unit for rehabilitation. We are one of 3 accredited units nationally. So we basically care for patients with complex neurological conditions, whether that's from an injury or an illness, and we aid that early rehabilitation for them. We do form the hub of the Cheshire and Merseyside Rehabilitation Network, and then from assessments that are taken within the ward, it's then decided amongst the multidisciplinary team where these patients would need to be spoked off to.
And that's across the region, isn't it? Cheshire and Merseyside, we've got units all dotted around different hospital sites.
We have, yeah.
Where they can be as close to home as possible, I guess, isn't it?
Yeah, it depends on what type of care the patient is going to require. Some patients may need a long-term tracheostomy and will need that long-term care, and then we have patients that might be decannulated from a tracheostomy that will do really well and can move on to other spoke placements.
Yeah. A lot of people, when they hear like rehab, they think therapies, they think maybe 6 or 7 months after whatever's hurt that person that the rehabilitation is going to start. But here it starts quite early on in somebody's journey, doesn't it?
Yeah, it does. The assessments usually start taking place once they're admitted onto the ward. We have got an amazing multidisciplinary team, and the collaboration amongst all the team members is just brilliant. Without all professional opinions and everybody working together, we wouldn't be able to do the job that we're doing.
And what is it like working on Lipton Ward, managing Lipton Ward?
Lipton's lovely. We've got an amazing team, like I've just said, and everybody works together, everybody's hard working, and everybody really cares for the patients as well. The patients are here quite a long time as well, so we become quite close with families as well.
Yeah.
And it's nice to have that relationship. We tend to have patients for a few months. Discharge planning can be quite long as well, so depends on the needs for the patient and, you know, the medical stability. Sometimes the patient might appear okay and then they could become really unwell, so it's just managing them complexities.
Whenever I've been on Lipton, obviously you guys are incredibly busy. They require that around-the-clock care. It can be quite intense, can it?
It can, yeah. The patients can be really complex with a lot going on. Like we discussed before around tracheostomies and stuff, it's not just airways we've got to manage. It's these patients are unable to eat, maybe due to swallowing difficulties. So they might be peg fed or NG fed. Generally the full care, they need assistance with moving, 2 hourly turns to relieve the pressure. They might need assistance with the toilet. Basically full assistance with all activities of daily living.
Pressure sores can be quite a challenge for an environment like this, can't they? Tell me more about the challenges at Lipton.
Yeah, so pressure sores, we've done really good with pressure sores. We did run an initiative over 4 years ago with the tissue viability nurse. We had an initial aim to become 150 days without a pressure ulcer. So we done a lot of staff training. Staff went on the trust study day. The tissue viability nurse would come to the ward and help wash patients and talk through how to relieve pressure areas and what staff should be looking for. And then from that, we just ran it off amazingly, and we ended up 4 years without a pressure ulcer.
That's an amazing achievement considering the patients that you've got. How does that make you feel? How does that make the team feel?
The team have just done amazing with it. I mean, we did do a poster which we've got displayed on the ward, which was presented by Wound UK.
Should we go and have a little walk around?
So I'll show you our poster. Yeah, so this was the poster that we done for Wound UK, and it's the complexities of the neurological patient cohort and how we put a collaborative approach together to prevent pressure ulcers.
And that's a national conference that you presented to, wasn't it?
Yes, it was in Harrogate at Wound UK. That was last year.
Yeah. And what was the feedback like?
The feedback was amazing. The staff were able to come with me as well, so we took one of the sisters off the ward and one of our HAs that were involved in it. They were able to come and watch the presentation there as well. It's
obviously nice for them to sort of see praise about the care that you're giving in Lipton, but also bring that back and tell everybody else as well.
The staff were made up with it.
What else have you got in Lipton? What makes it slightly different to maybe a normal ward?
So we've got the rehab gym, basically. We've got all the machinery in there, what the physios and OTs will use to do the sessions and stuff. Yeah. So it just depends on the complexity of the patient. All patients aren't able to use the gym, but they try and get most of them down there who they can. This is the therapy office.
I recognise that voice.
As I mentioned before, we work a lot with the therapists.
You've got a couple of bays on Lipton, haven't you?
We've got 2 bays and 3 side rooms. And then obviously we've got the nursing station as well, where the nurses are based and where they do the documentation and everything.
Again, it's quite busy on here today. You've got lots of people. You've even got staff who are sort of waiting outside doors. Why is she sat by the door there?
Because the patients are one-to-one. So if the patient's got a tracheostomy, if they're in a side room, they need a staff member watching over them, because if they require suction, they're unable to tell us. So the nurse is there to basically provide that suction if the patient needs it.
Now that you've been a ward manager for how long now?
3 years.
What do you think of Lipton then? What's it like to manage it?
It's a lovely ward to manage. All the staff are amazing. They all work really hard together, and we've got that close-knit team. I think we're able to discuss challenges together. Staff are able to ask you for support. All the staff will knock on my office and go, can you come and help me do a turn, or
you get stuck
can you give us a hand with this? Yeah, and we're always here to help each other.
It's an obvious question, but why is it important?
If you didn't have teamwork, you wouldn't be able to do the tasks that need doing. If everyone didn't work together, stuff would be missed. Yeah. The patient wouldn't get the best care. So we've got to ensure that we're working together to provide that for the patient.
Thanks for listening to Neuro Stories. You can listen to more episodes on Spotify and Apple Podcasts, and you can stay up to date with the latest news and events from the hospital on our social media channels, at the Walton Centre on Facebook and Instagram, and at Walton Centre on X. If you've got any feedback, email the communications team at wcft.communications@nhs.net. This podcast was recorded, edited and hosted by Sam Fleet from the Walton Centre's communications team.